And then if you're just to describe the surgery in layman's terms,
Yes.
the
Laparoscopic surgery.
Yes.
Now, see, the traditional surgery entails big cuts, opening up your tummy and then doing the surgery. So because of those big cuts, there is significant amount of pain after surgery. There is slower recovery. Someone may not be able to get out of bed very fast. But laparoscopic surgery, in simple terminology, are keyhole surgeries. So we make small holes which are size of a keyhole. Through those keyholes, we put cameras inside. We can see whatever is inside on a TV screen. Then other keyholes, we put some instruments, and under that television guidance, we move our instruments inside your body and we can perform a surgery. Basically, the cuts are very small, so pain is significantly less compared to the traditional surgeries. The chances of bleeding, infections are much less, and the recovery is much faster.
What would you say are just general misconceptions that people have about laparoscopic surgery?
I would say they think that laparoscopy is very expensive.
Definitely.
True, it's a little bit expensive than the traditional surgeries, but I would say it's not very expensive unless the higher end surgeries. But the most common surgeries like a hernia repair or an anti-reflux surgeries, gallbladder removal or appendicectomy, if you see the overall cost, usually laparoscopic surgery are more cost effective because you see, once you go for an open surgery, you need to spend about 2 to 3 days in the hospital. So your hospital stay is longer. So that adds up on your bill. You stay from your work for significantly longer time. So that affects you in terms of your income. And when you do a laparoscopic surgery, you may be discharged the same evening or maybe the next morning. So your hospital stay is shorter. So you cut down on your hospital stay, those medications. You can return to your work faster. Your income doesn't get compromised. So if you compare those things, eventually the laparoscopic surgeries are more cost effective.
How do you determine whether a patient is a suitable candidate for the laparoscopic surgery?
Almost always, all the patients can be suitable for laparoscopic surgery, except there are specific contraindications. Like when we want to do laparoscopy, we put a lot of gas in your tummy, like carbon dioxide. So if someone is having heart issue or lung issue, it may affect them. So if your cardiopulmonary reserve is compromised, you may not be able to undergo laparoscopic surgery. It also depends upon disease severity, like some cancers, if they have been too extensive, if they have spread to multiple organs, sometimes laparoscopy could be difficult. But otherwise, most of the patients, they are suitable candidate for laparoscopy as long as they don't have such contraindications.
Or like underlying conditions.
Underlying conditions.
Okay.